Welcome to BW Healthcare World. Today we'll be talking about one of the less discussed and yet quite dangerous disorder known as epilepsy. Now, as per the WHO numbers, around 50 million people worldwide have epilepsy, making it one of the most common neurological diseases globally. The report says that nearly 80% of people with epilepsy live in low and middle income countries. If we talk about India, reports suggest that the country accounts for one fifth of the total global cases. It is estimated that up to 70% of people living with epilepsy could live seizure free if properly diagnosed and treated. Now, let me introduce my guest on the panel today who will tell us more about epilepsy, what it is, what causes it, and what can prevent it. Firstly, we have Dr. Mukesh Kumar, Associate Director and Head Neurosciences, Neurology, Max Super Specialty Hospital, Saket. We are also joined by Dr. Pramod Krishnan, HOD and Consultant Neurology, Manipal Hospital, Old Airport Road. Thank you again for joining us, doctors. Thank you for giving us your time.
Welcome, sir.
Thank you. Thank you.
Dr. Mukesh, let me start with you first and understand what is epilepsy, what are seizures, and do we know what causes it? If yes, then tell us what.
So, epilepsy or seizure, it is a synonymous word, and it is an episode of loss of consciousness or loss of response, transient, lasting for 1 minute to 5 minutes, and with complete recovery maybe in few minutes to few hours. So, in general, यदि हिंदी में बोले तो मिरी का दौरा एक ऐसा है कि आपको कुछ देर के लिए बेहोश कर देता है और आसपास के सराउंडिंग से विलुप्त कर देता है। लगता है कि जैसे आप वहां पे हो ही नहीं, और फिर जब आपको ध्यान आता है तो आपको लगता है कि क्या हुआ था मेरे साथ। सिंपल वर्ड में ये बोला है। कुछ केसेस में आपको हाथ पांव के मूवमेंट दिखाई देगी, पर कुछ केसेस, मैक्सिमम केसेस में ये जरूर है कि आपको लॉस ऑफ रिस्पॉन्स दिखाई दे। मीन्स जैसे एग्जाम्पल, कोई बच्चा एक स्कूल में क्लास में पढ़ रहा है, करते 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 थोड़ी देर के लिए वो एकदम स्तब्ध हो जाएगा, टीचर की बात नहीं सुन पाएगा, रिएक्ट नहीं कर पाएगा, और 10 सेकंड के बाद वापस आ जाएगा। ये दिस इज अ टर्म एज एब्सेंस सीजर। इसमें मोटर मूवमेंट नहीं हुआ, आया, लॉस ऑफ रिस्पॉन्स हुआ, चला गया, बट बिकॉज कि वो स्कूल में अटेंडेंस नहीं दे पाया तो उसका कॉग्निशन थोड़ा सा, ट्रेनिंग बेटर हो जाएंगे, तो वो ग्रेजुअली टीचर बोलते हैं कि लगता है उतना अच्छा नहीं पढ़ पा रहा जैसे पहले से पढ़ता था। दूसरा जो कॉमन है, जो दुनिया को पता है कि कभी कभी कोई भी बेहोश होकर गिर गया और उसको ऐसे फिट मूवमेंट आने लगे तो वो सीजर, ठीक है। तीसरा एक ऐसा और भी होता है जिसमें आपको सिर्फ एक हाथ की मूवमेंट होती है, मरीज होश में होता है, पर एक ही हाथ ऐसे 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 झटके मारता है या थोड़ी देर के लिए ऐसे झटके मारता है, पर बिना बेहोश हुए, बिना लॉस ऑफ रिस्पॉन्स हुए। तो इस तरह से हम लोग सीजर को दो पार्ट में डिवाइड करते हैं, एक जनरलाइज सीजर एंड सेकेंड इज पार्शियल सीजर। जनरलाइज सीजर मीन्स पूरा हाथ पांव चलेगा, आप हर किसी सिचुएशन में बेहोश हो जाओगे। एंड पार्शियल सीजर मीन्स आपको बैठे रहोगे, बात करते रहोगे, थोड़ी देर के लिए गुम हो जाओगे, हो सकता है हाथ पांव के मूवमेंट हो सकता है लिप्स के मूवमेंट हो, पर कुछ देर के बाद फिर आप ठीक हो जाओगे। यदि एक एपिसोड होता है तो हम उसे सीजर बोलते हैं। इफ इट इज कॉम्बिनेशन ऑफ मल्टीपल एपिसोड in over a period of maybe 1 month, maybe 1 year, then we term it as epilepsy. अब what is the causes of epilepsy? Causes of epilepsy differs as per the age group and as per the situation, clinical situation and demographics. Suppose the patient is in from the Indian field communities or it is slum areas, the most common is neurosocial psychosis in across all age groups. So suppose it is in children. Children means less than 6 months. Then chances is calcium infection, some structural defect of the brain, कि brain उतना grow नहीं कर पाया जितना होना चाहिए था। फिर यदि हम up to 10 years बोलें तो brain growth, infection, brain damage, other regions. Then 16 से 45 साल के बीच में brain में कीड़ा, जिसको न्यूरोसिस साइकोसिस बोलते हैं, और 45 के बीच में ट्यूमर भी एक इंपॉर्टेंट फैक्टर होता है, हेड इंजुरी एक फैक्टर होता है, जो ये कॉमन है। अनकॉमन तो बहुत सारे अदर है। 45 से 50, 45 से 80 के बीच में स्ट्रोक एक रीजन फैक्टर होता है, ट्यूमर रिस्क फैक्टर्स होता है। मेडिसिन रिस्क फैक्टर होता है कि कभी कभी हम कोई ऐसी दवा दे जिससे दौरा प्रोड्यूस हो जाता है. तो दीज आर द थिंग्स विच हैपेंस.
Right. So there are multitude, there are many causes of epilepsy, as we know. Uh, you've also highlighted the common types of epilepsy. Tell us, in India, which ones are more prominent ones? Uh, Dr. Pramod Krishnan, if you can tell us this one. Also tell us, their common symptoms also.
Okay, so Dr. Mukesh has already addressed it, but I'll just continue with that. So all epilepsies can be basically divided into two types. One where the problem lies in a part of the brain and the abnormal electrical activity, which is the basic reason why people get seizures, that abnormal electrical activity, that excessive, uncontrolled activity starts from a particular part of the brain. So we call this a focal epilepsy. So epilepsy starts in one particular part of the brain, then it can spread, the signals can spread and move and involve the entire brain. So when you have a clear-cut origin or source of the electrical signal, we call it as focal epilepsy. The other type of epilepsy is called generalized epilepsy. Here, you cannot identify or pinpoint a focus. The entire brain is showing excessive, unwanted, uncontrolled electrical activity at the same time. So, this kind of epilepsy, we call it as generalized epilepsy. So, in generalized epilepsy, the exact origin is not clear. Entire brain activated all at once. In focal epilepsy, there is a particular part of the brain which is the beginning of the epileptic attack. So this distinction is important because it will help us in deciding what kind of medicines will work in each of these patients. Now, under that, there are again many types, which Dr. Mukesh has also described. So when you look at the symptoms of epilepsy, if the epileptic attack starts in a particular part of the brain, that can be the initial symptom. It could be just a twitching of the hand, jerking of the face, and then it spreads. And then the patient may become unconscious. So if it's a focal epilepsy, you have symptoms in a particular part of the body, can be face, hand, leg. It could be a motor symptom. It could be just tingling, sudden tingling, spreading tingling, could be a sensory seizure. And as Dr. Mukesh clearly showed, attacks where a person goes quiet, does not respond, he's staring somewhere, and he's doing some lip movements, what we call as epilepsy starting from the temporal part of the brain, the temporal lobe part of the brain. So these are all some of the symptoms of focal epilepsy. One part twitching, one part tingling, going silent, going quiet, like that. But when the entire brain is affected, what we call generalized epilepsy, what we see in the beginning is a sudden shout or scream. Then the patient immediately loses consciousness. The whole body goes tight, what we call tonic seizure. So initially it is tight, eyes go up, that they may clench their jaw, their teeth. Then the tightness starts jerking, and then the jerking increases, and the patient may end up biting their tongue. Blood may come from there. They may pass urine in their clothes or even soil their clothes with excrement. And then this goes on for 1 or 2 minutes. And after that, it stops. And once it stops, the patient is still not normal. He's drowsy, confused. When you try to call him, he might open his eyes, look at you, but he's not registering who's there, where he is. And then gradually the confusion clears and he gets back to normal. And at this point, he may complain of headache, vomiting, tiredness, body pain. He may sleep off. So the one I described is the well-recognized convulsion or seizure, generalized seizure. And the other ones which I described are what we call focal seizures.
Right,
So
right.
these are the two basic types.
Right. We talk about the generalized one when, in many cases, a person loses its consciousness and, behaves in a certain way, which can, also get other members of the family to panic. So in these situations, is there a guideline that must go out? Like if a person gets unconscious or showing these kind of symptoms, what is the next step they should do, Dr. Krishnan?
See, what they should do is a generalized seizure. Many people do too many things which are actually not required and are actually harmful. So the first step is safety of the patient. Make the patient lie down horizontal on the bed or on the floor. Keep him horizontal and turn him to one side, either right side or left side. Stay with the patient. Make sure that he's away from furniture, walls, or other places where if he's jerking and he's striking the furniture, he might injure himself. So move him away from those places, turn him to one side, and then the patient is jerking violently. Some people, they all rush on the patient. They hold his shoulders, legs, arms, and try to restrain him. Don't do that. When you restrain a person who's jerking violently, you might end up causing ligament injury, muscle injury, joint dislocations. So just turn him to one side, support the patient, let the seizure end on its own. The other thing people do is there is sudden tight clenching of the teeth, because of which, if the tongue is between the teeth, the tongue gets bitten. So many people try to prevent it in the wrong way. What they try to do is they try to force the mouth open. They try to push their fingers between the patient's teeth. They try to put a spoon between the patient's teeth. They may even try to insert cloth between the patient's teeth. But these are all dangerous things. The jaw is so tightly shut that if you try your full force to open it, you might actually injure the lips. You may dislocate the jaw. If you try to push a spoon inside, you may dislocate the teeth. You may injure the lips, cheek, tongue. And in case the spoon does manage to go through, the patient's bite force can be so powerful that the spoon may break and the piece inside can go into the throat and choke the patient. If you put cloth between the teeth, you may suffocate the patient. If you try to put your own fingers, your fingers can get bitten off. So do not attempt to prevent a tongue bite. A tongue bite, if it has to happen, will happen, not a dangerous injury. Within 3-4 days, it will heal perfectly and completely. The other thing that patients do wrong is leaving the patient running around to get some iron piece, a key or a chain or something to keep it in the patient's hand because they feel putting that in the patient's hand will stop the seizure. This is a myth. There is no scientific basis behind it. So wasting your time running around hunting for a metal object should not be done. Another major mistake people do is trying to pour water or juice into a patient's mouth when he's having a seizure or just after a seizure. At this point, the patient is unconscious. If you pour anything into the mouth, he cannot swallow it. It will, in fact, end up going into the lungs, triggering a bad lung infection. Patient will choke on it. So the basic advice to family is these are all the don'ts. Don't do these things. What you should do, position the patient horizontal, then turn to one side, be with the patient till the seizure is over. The seizure will be over in 1 or 2 minutes, and over the next 5 to 10 minutes, the patient will come back to normal. But if the seizure does not stop in 2 minutes or maybe 3-4 minutes, immediately rush the patient to the hospital. Inserting things between the mouth should not be done. Putting water or liquids into the mouth should not be done. Restraining the patient with force should not be done. Running around to get metal objects should not be done.
Right, right. Thank you. Dr. Kumar, let me come back to you. When it comes to India, we have one of the, 1/5 of the total epilepsy cases of the world. And reports also suggest that it is supposed to increase in times to come. What is your opinion on it? What, according to you, is the prevalence of epilepsy in India? And are we seeing an upward trend in its cases? If yes, why?
So in general, if you say the incidence is 6 cases per 1,000 populations. The 6 cases out of 1,000 population can have seizure or epilepsy one episode at any point of time in general. If patient has one episode of seizure already, then chances of recurrence of seizure is quite high, which may increase around to 10% to 40%. But in 60% cases, the seizures may decrease automatically without any medication. In India, the one of the most common cause is hygiene issues, and there is a cysticercosis going into the brain and leading to neurocysticercosis. Neurocysticercosis, among 100 cases, only 50% cases are asymptomatic, means they just die down inside the brain. Remaining 50% may present have single episode of seizure in their lifetime, and then some 10 to 20% cases continues to have seizure, and then they come into the hospital or can take doctor's opinion or physician opinion. They are generally seen by the general physician and started on some anti-epileptics, but they are not educated enough to understand that how long to take the medication, or how to control, or how to monitor the treatment. They just start and then stop as with whips and fancy of their thoughts or their friends. So in Indian circumstances, we say, so it is around 10, more than 10 lakhs patients are there, and the concentration is distributed across, evenly distributed. It is not that it is concentrated in one particular state or one particular community. We see some number of seizures in all types of cases, even in high class cases where the hygiene is very important. We have seen cases of neurocysticercosis coming in that age group or that type of family also. So epilepsy or seizure, what we say is something which just happens. It is cannot be prevented. Once it is there, then I can suggest how to prevent further or how to get cured from that episodes. But before that, nobody can predict which person it may happen or which one it doesn't happen.
Right, right. Do genetics also play a big role in the causes of epilepsy? And also, yeah, first, please answer the genetics part.
Regarding genetics of epilepsy, it is less than 5% of the all cases.
Okay.
Usually, we never see. Usually, it is in general practice. Once in a year, we see that one genetic positive cases or significant geneticity is present. Maximum cases are goes with tumor, neurocysticercosis, or some form of structure defect starting from the infancy, or some form of juvenile myoclonic epilepsy, which starts from 12 to 16 years of age. So genetics, yes, it's important, but it is not that much. That is not statistically significant that we need to worry. It is
What about trauma or a head injury?
all head injury has predilection for epilepsy. So they say that 1/3 of the post-traumatic cases, if you give anti-epileptic within for the next first 3 months, they get resolved completely.
Okay.
But remaining 1/3, they continue to have a seizure if there is a structural defect or there is a damage inside the brain.
Right.
So trauma is one of the biggest cause, and if significant head injury, means all type of road accident, then it increases the chances of getting epilepsy by 50%.
Right. Let me ask you one more question related to genetics. And if a lady is pregnant and the kid is inside, if lady is having seizures, will that affect the baby?
Yes. But it is not related to genetics. It is related to more of
Right.
the metabolism. So
Okay.
if seizure happens, then it increases the chances of abortion.
Okay.
Because of the muscle contraction, some uterine contraction may push the baby for abortion. So that's why we always push that ensure good medical compliance in all pregnant ladies with seizures.
Right.
And
Right.
sometimes also there is a medicine related teratogenic effect,
Right.
but that is less than 5% of the whole pregnancy. But otherwise, no genetic transfer of trait or tendency of seizure to the child.
Let us talk about now about the diagnosis or the counseling of epilepsy cases. Dr. Kumar, tell us, how do you do that, first of all, and what are the treatments that are available, and are there any treatment variations which have happened over the course of last few years?
Okay, so whenever a patient comes, the first important thing is whether how to identify. So suppose just a few days back, one baby come, and it is she's 6 years, 6 years, and they said that while sitting, she just had a, and then she just lost the response. So she is not able to respond for 2 to 3 minutes, and this happened 2 times. So when I disclosed that it is most likely a seizure, the patient, the family members didn't accept it. They said, "How it's possible?" So then we have to investigate to show that okay, this let's investigate, do the MRI and EEG, mainly the structural imaging of the brain and electrical activity of the brain. After that, it may turn out to be normal in 50 to 60% cases. But in spite of that, because some episode has happened, you have to start on the medication. If it continues to happen even on medication, then we have to think of some structural, some biochemical defect like calcium, kidney, liver, CBC. And then gradually, once we omit all the other reversible factors, then we say that, okay, as of now, you need to take medications. And that medication is based on type of the epilepsy, structural defect of the epilepsy, and age group of the patient. Suppose that it is pediatric population, then we try to give valproate more often. But the in child, if there is obesity, and if the child is in the menstrually active and there is a periods difficulty, then we like to avoid valproate. We'll give to switch out to something new medications. So one of the commonest medication so far is valproate, levetiracetam, and phenytoin. And this usually works in 80 to 90% cases. 85% cases gets controlled with one or two antiepileptics. Okay, and you have to continue. Usual protocol is that you take the treatment for 2 to 3 years and then take a break. And if seizure happens again, then restart the medication. And sometimes if person is very active, suppose that person is driving, then the person is professionally active, then we say that okay, please continue the medication if you are controlled with the medication. Don't take a chance, because any seizure may harm the body parts, may lead to fracture, may lead to shoulder dislocation, or may lead to a head injury if you are in the unexpected place or unexplained places, or in the from the height. So in the treatment protocol, the protocol based on the age group, type of epilepsy, overall well-being, any side effect related to obesity, hair loss, menstrual disturbance, these are the things to be concerned. Then in elderly, the drug interactions, whether the patient is taking any BP medications, sugar medications, heart medications, drug interaction is important. Then and then important is counseling about the continuity of the medications, regular care, regular follow-up, and dose adjustment depending upon the effect and side effect.
Right, right. Dr. Krishna, let me come back to you. Dr. Kumar said that it is not yet preventable, but once you have it, you can prevent it. So tell us your opinion. Is epilepsy preventable? If yes, how?
Yeah, so at an individual level, Dr. Mukesh, you wanted to say something?
Epilepsy is not preventable. Once means once you diagnose that epilepsy is there, then you can prevent it by lifestyle modification and medications. The lifestyle modification is important, is sleep deprivation, to avoid sleep deprivation. Means you have to be timely on bed and timely to get out of the bed. One means you should preferably be on bed by 10 a.m. p.m. and then we will leave it around 5 to 6 a.m. Second is avoid any types of habit forming things like alcohol or smoking, or anything, something like a hookah, something like a cough syrup related addictions. So this is also important. Third thing is try to avoid anything which is uncooked, even including your salad. The concept is that even salad should not be uncooked. Means pyaj, something like onion, uncooked onion and uncooked leafy vegetables can lead to increased chances of cysticercosis. And along with that, regular recall about the medication. You have taken the medication at appropriate time. Any gap of more than 24 hours can increase the chances of epilepsy. So lifestyle modification, medicine compliance is important to prevent the further episodes.
Dr. Krishnan, would you like to add something?
Yeah, so as Dr. Mukesh said, at an individual level, prevention is difficult, but it can be done at a macro level, that is society level, government level. So if you look at children, one of the common causes of epilepsy that we see is birth related injuries. Okay. Poor care at the time of delivery, where the child is not handled properly, the baby develops lack of oxygen or low sugar or infection in a very young age, like immediately after birth. So these issues can leave behind damage in the brain, which subsequently turns into epilepsy later in life. Hmm? So, birth related medical complications to the baby are a major cause of epilepsy in developing countries, underdeveloped countries. So, improving maternal care, ensuring babies are delivered in the hospital, ensuring that they are provided with good neonatal care, NICU care, their initial medical issues are quickly identified and treated, will prevent a lot of children from developing epilepsy. So, that is one. Second is, in if you look at Western countries and India, there is a big chunk of patients for whom infection is a cause of epilepsy. So tapeworm infection, what is called neurocysticercosis, tuberculosis of the brain. Okay, so these are also things where you can have epilepsy later. So if you provide good hygiene, many of the tapeworm infections are because of sewage contaminating a food supply. So, if we take care of the hygiene part of it, these infections will come down. Their ability to then convert into an epilepsy later will also come down. And third thing, which is also a common cause of epilepsy in our population, is head injuries, as was already mentioned. So, accidents leading to head injuries. So, more counseling regarding protective gear, helmets, etc. So these can all, at a macro level, influence and reduce the chances of epilepsy. But if you ask me, like if you ask for yourself or me, how can I prevent? That is very difficult. You cannot prevent. No, you don't know whether you'll get a tumor or a stroke or something.
But it can come down to just washing my hands before eating and just being hygienic. But I would never know that it is working or not. But that's just prevention is better than cure.
That's the latest. That is the least you can do, because in India, the Indian healthcare system is inundated by hygiene related complications, and the least we can do is make sure that we eat cooked food, because tapeworm infection is passed through uncooked food. Avoid eating fresh vegetables from the hotel and all, because we don't know whether they are washed properly. At home we can probably wash well, but we don't know outside.
Right,
Washing your hands. So these are some basic precautions that will at least protect you from certain types of epilepsy.
right, right, right. Dr. Kumar also mentioned that there are some guidelines that doctors give out when people are getting diagnosed with the episodes of epileptic seizures. When a person is driving or person is kind of swimming, so they can have. So, do you tell them to avoid these things while they're on the medication, or when they're in the medication, then they're on the medication, they can still go on and do these things?
So basically, there are few restrictions. According to Indian law, driving is not allowed for a person with epilepsy. Okay, but in the West, the law is more liberal. If you are seizure free for 1 year and you are continuing to take medications, you are allowed to drive in Western countries. Whereas in India, there is no such exception. So if you have epilepsy and you are not having seizures now because you're on medications, you still don't have the freedom. So we tell the patients accordingly that you should not be driving when you have a label of epilepsy, but we do tell them about what is happening abroad and what rules are being followed abroad. But in India, the rule is yet to be modified. So that restriction definitely remains. Swimming, we tell them that they can swim only if there is a trained, capable swimmer with them in the pool, watching them all the time. If such a facility is not there, then it is probably not safe to swim. Like if it's a bunch of school children in the pool and one teacher watching everybody, it may not be safe. But if the father of the child is in the pool with him, then it's probably okay. And of course, any adventure which relates to climbing, climbing trees, climbing ladders. These kind of things are not encouraged. But all ground level sports, football, cricket, hockey, basketball, all that is fine. In fact, we have so many sports person with epilepsy having fantastic professional careers, including John T. Rhodes, for example, in cricket. So we too tell them that you have an array of sports that you can follow, but few things that you should avoid. And then regarding the general rule, it's about the regularity of the medication, timing of the medication, and everybody should understand that sleep is a medicine for an epilepsy patient. They need to sleep 7 to 8 hours, not at any random 7 to 8 hours, but at proper sleeping hours. So somewhere between 10 to 11, you go to bed and wake up at 6 to 7. That kind of routine followed every day will itself enhance the protection provided by the medicine. Avoid fasting, avoid alcohol. These are some of the things we also tell them. Be mentally relaxed. That helps because stress can be a trigger. Then, as you mentioned, some people, they still get seizures. They are doing everything right, but they are still getting seizures. In such people, we have to really look at their medications because there are many epilepsy types and there are many epilepsy medicines. So it's not that everything works for everything. You need to know which epilepsy type and select the right medicine for that type. So we need to know whether the person is getting the right medicine, and every medicine is given as per the weight of the patient. So is the dose of the medicine correct? And then when you use combination of medicines, some of them don't go well together. They in fact work against each other. So is the combination correct? So these are all the things that we should see when somebody says, I've come back with seizures, even though I've done everything correctly. So we focus on the medical factors, the choice of medicine, dose of medicine, combination. We look at lifestyle factors, sleep, stress, food intake, habits. And these are things that we have to reiterate every time we see the patients.
Right, right. Dr. Kumar, tell me, do you think the treatment gap is high in epilepsy in India? And even though the country has one of the biggest epilepsy caseloads in the world.
The treatment gap is, yes, really high. So what we see in the OPD, first one person came, सर साल में एक बार दौरा पड़ता है, क्या करें, नहीं खाने का मन करता, दवा नहीं खाने का, ठीक है। दूसरा, दवा का साइड इफेक्ट बहुत है, आपको दवा से शरीर सूख जाता है, इसलिए हम दवा नहीं खाते। तीसरा, कि कितने साल दवा खानी पड़ेगी, इतने साल हम नहीं खा सकते। चौथा, रेस्पॉन्स की फिजिशियन जो आपको पहली बार पेशेंट देखता है उसको एक्सप्लेन करना कि दवा कौन सी लेनी है, कैसे लेनी है और कितने दिन लेनी है। तो दीज आर द कॉमन treatment gaps where the compliances gets limited in general population. We try to explain them, but every time whenever the person comes to in our OPD, they try to ask how long and why me. These are the two questions which are always there, and answer is nothing. Okay.
Right. Dr. Krishnan, are there any challenges when it comes to a medical professional or medical professional in rural areas? Dr. Kumar highlighted awareness is a big issue when it comes to epilepsy. Tell us about the, systematic issues, if there are any.
Yeah. So, right, there are system issues as well. One is, of course, the medical person being adequately trained in identifying epilepsy. So there are people who faint because of low BP. There are people who faint because of stroke-like episodes. There are people who faint because of stress episodes or psychiatric illness. So identifying epilepsy itself becomes a challenge, especially in rural settings where you do not have access to MRI, EEG. So you have to depend more on your clinical knowledge to diagnose epilepsy. And sometimes you end up underdiagnosing it. Sometimes you end up overdiagnosing it. And familiarity with, even if you have the test, interpreting the test is also a challenge. Whether it's abnormal, normal, not so easy unless you're having enough training in that. Then, of course, not being familiar with epilepsy types, what medicine to choose, how much to give, how to adjust the dose for a child, for an adult, for an elderly, for a lady who's pregnant. So there is a knowledge gap also within the medical community at the level of rural practitioners or people who are not that much into neurology. There are these challenges. And once the diagnosis is made, so many patients do not even reach the right doctor who can make a diagnosis. And once somebody is diagnosed correctly, they do not have access to the right medicine. And somebody has access to the medicine, they are unable to keep it going for a long period because of social and economic issues. So all of these at different levels, of course, Dr. Mukesh already mentioned that even if the doctor is there, medicine is there, money is there, the patients may not be willing to take it for various reasons. Primarily thinking that one, they don't have epilepsy and the doctor is saying so, but it's not true. Second, that epilepsy, they cannot be treated for so long because it's harmful for the body to take medicines for too long, or it will do some problem to their family, their child, their cognitive abilities, their physical abilities, their reproductive abilities. So there are so many concerns, and a doctor may not have the time or the opportunity to clear these doubts from the patient's minds. And many patients who do reach the treatment stage may drop out. So these are all challenges which are, we have been putting in the effort, but it's a very slow progress. So I would say one important thing is to delegate the treatment of epilepsy from neurologists to physicians by training the physicians so that they are empowered to take these diagnostic decisions. And no, the neurologist, we cannot have enough neurologists to treat epilepsy in India, so it has to be done by the physicians mainly.
Right. If it's that common, it should be physicians should be aware about it. And you rightly said that in the rural areas we do not have enough neurologists, and I'm not sure if we have them appropriately in our urban towns as well. So, Dr. Kumar, tell us about are there also any stigmas? Dr. Krishnan mentioned a lot of myths regarding when an epilepsy is occurring, what should not do, and what people consider would work. Are there any stigmas when mental health itself is a big stigma, but with related to epilepsy?
In epilepsy, most common stigma is लड़की है शादी कैसे हो. This is the one of the worst stigma we face, and every person, every parents ask this question. कि how we manage, क्या मेडिकेशन से नेक्स्ट जनरेशन प्रॉब्लम आएगी कि नहीं आएगी, क्या पेशेंट फीमेल प्रेगनेंसी अटेंड कर पाएगी कि नहीं पाएगी, उसकी मैरिड लाइफ हो पाएगी कि नहीं, या उसकी फैमिली उसको एक्सेप्ट करेगी कि नहीं करेगी. ठीक है.
How do you bust these myths? What do you tell them?
Difficult, but sometimes 80% of the female with the female type of epilepsy usually gets controlled with one of the important medication is levetiracetam. Okay, levetiracetam is very safe, so I can say that if you are controlled with medication, enjoy the family, enjoy the life, enjoy everything, and you are like a general population. Okay, everything is okay with you. Okay, but if you are on more than two medications, more than 2 and 3 medications, then chances of the birth-related side effects is increased. But gradually, what we see, there are many families who accept the seizure cases. The female get accepted and accommodated in the family. So usually, I suggest them, let it be 1-to-1 from the bride and bridegroom. They will discuss whether they have medical issues or not, instead of other family members interfering into this aspect. Second thing is regular medical compliances, regular medical consultation, so that your seizure gets controlled, and then you can do whatever you want. Yes, some uneducated class risk comes with something wrong is happening, कोई भूत तो नहीं लग गया, तो कभी कभी वो सिकाई कराने चले जाते हैं, कभी कुछ झाड़ फूक करा लेते हैं, पर ग्रेजुअली समय के साथ ऐसे केसेस कम होते जा रहा है.
Right.
जनरली फीमेल एंड बर्थ वियरिंग एंड फैमिली एक्सेप्ट करे कि नहीं करके, दिस इज वन ऑफ द कॉमनेस्ट मिथ.
Right, and the message needs to go out loud and clear that it's totally curable and treatable with the appropriate medication. Dr. Pramod Krishnan, would you like to add something to that?
Yes. So one problem we face is in many patients with epilepsy, we cannot show them a cause. The test reports are normal. Then the patients find it very difficult to believe that they have a problem in the brain. So they resist the diagnosis. Like if somebody has a stroke or a tumor, you can show it on the scan. You can tell them this is the cause. But in many patients, we don't see the cause. That's not because the cause is not there. It's because our technology does not reveal it to us. It's limitation of our technology. But patients tend to think, no, I don't have it. No, these doctors are just putting some label, some diagnosis. So that is one problem. And we have to explain to them, see, with every test, there are limitations. And you cannot pinpoint and show every aspect of the brain, even with an advanced MRI or an EEG. So they have to go, or we have to convince them about the diagnosis. Once they are convinced that they have a problem, they might be willing to deal with the problem. The other problem I faced a lot is where patients are scared to take the medicine because they've read somewhere, or somebody has told them that it damages the liver, it damages the kidney, and things like that. And as Dr. Mukesh has already said, the medicines now are the newer ones are reasonably safe. I would say very safe. They can be used in pregnant women, newborn babies. So the impact on major organs is negligible. And so that is another concern that we can address, and it's always comes in the way of treating these patients. Another aspect that I would like to highlight, which not many are aware of, is that in some people we can actually surgically correct epilepsy. We can identify the part of the brain which is causing the epileptic attack, and if it is possible, not in everyone, if it is possible, in some people we can actually surgically remove that portion. And once that is done, the epilepsy is as good as gone. And many of them can be seizure free and even discontinue their medications. So when we try to give these options, they're immediately scared. What, surgery for epilepsy? Never heard of it. And this is something that is too drastic, and we cannot even think of it. So there are a lot of challenges, but the only way to deal with the challenges is to have a two-way communication where we encourage patients to ask the questions to us rather than asking the questions to family or friends, and give us the opportunity to clear their in a high caseload areas where a doctor is overloaded with patients. This kind of time and opportunity will not be there.
So we've talked about, the awareness issue. It's such a big one, and there is medical workforce training also, which at times, is the reason of the treatment gap. So, what, according to you, should be the roadmap from here on to tackle the rising stack of epilepsy in India? Dr. Krishnan, if you can start first.
Yes, so I feel, see, as Dr. Mukesh has already said, and what you have also said in the beginning, the load of patients, the number of patients is humongous. And we do not have enough neurologists to deal with this. So epilepsy should become a training, it should be part of the training of MBBS level doctors, MD medicine doctors. And wherever they are trained, the neurologists in that center should take the lead in in providing information and training to these healthcare professionals, so they go out into the community when they pass out, and they provide the correct diagnosis, treatment, and follow up for these patients in suburban or small town or rural areas. So I think that is the main thing. And of course, media can be used very proactively and productively to disseminate some basic information regarding the need for approaching a doctor if there are certain set of symptoms, and precautions to be followed in terms of treatment, and other precautions to be followed when there is a seizure. So I feel it has to be multi-pronged, and of course from the government level, the government should provide quality, safe anti-seizure medications at the primary healthcare level, where doctors can give it free, so that at least the economic burden on the patient is taken off, and patients do not quote money or lack of accessibility as a reason for not taking the medications. So I think these are some things that I can think of.
Right. Dr. Kumar?
May I ask the question again?
So what do you think the roadmap from here on should be like to tackle the rising stack of epilepsy cases in India?
The Dr. Pramod has already explained. The most important thing is the training of the uh,
Just
first
wanted
referral
to
doctor.
understand your view on it.
Training of the first referral doctor means the every doctor, every general physician should be aware of the how to adjust the medications, how to start the medication and medication doses as per the body weight. And then if it is not controlled, then refer to neurology.
Right. So awareness among the medical professionals themselves and awareness among the general public about epilepsy and what should one do and what should one not do. On that note, thank you to Dr. Kumar, Dr. Pramod Krishnan for joining us here and talking about epilepsy. Thank you for taking out time to do this.
Thank you so
Thank you,
much.
Tagji.
It's my pleasure. Thank you so
Thank
much.
you.
Thank you,
Thank you,
Thank you.
Dr. Mukesh. Thank you.
thank you. Bye.